It's a medical condition that severely affects daily living habits and activity. According to recent studies, over 40 million Americans live with some form of venous insufficiency, the cause of varicose veins and spider veins. Doctors say if left untreated, they can become problematic and often lead to skin damage, bleeding, and ulcers. Today, vein disease can be addressed and treated with state-of-the-art care in an outpatient setting, which consistently produce safe and proven results.
Some of the major causes of venous insufficiency include family history, gender, age, occupation, patients that are on their feet for prolonged periods of time. Venous disease is a progressive condition, and if left untreated, it will lead to the development of permanent swelling, skin changes such as hyperpigmentation, and eventually the development of ulceration. Venous disease treatments have significantly evolutionized over the last 15 to 20 years, going from invasive treatments to minimally invasive treatments, which really allow for earlier diagnosis, earlier treatment, and better outcomes.
Throughout its 70 locations across 12 states, the Center for Vein Restoration has provided relief to thousands of patients suffering with the pain and embarrassment associated with spider and varicose veins, quickly and relatively painlessly, so patients can return to normal activity with short-term recovery times.
The three pillars that Center for Vein Restoration very proudly stands on: excellent healthcare, cutting-edge research where we not just follow standards of care, but we define those with the help of our associations. And the third pillar is the phenomenal support staff that helps us deliver this excellent healthcare to our patients.
With doctors trained in all of the modalities of vein care, the Center for Vein Restoration offers a full menu of in-office treatment options specifically tailored to help each patient clear up their signs and symptoms and get back to a more comfortable way of living.
Our physicians treat the entire venous system and not just the spider veins in the legs.
There are lots of diagnostic modalities available for diagnosing venous insufficiency. One of those is a duplex ultrasound. That's where we look at the anatomy, we look at the physiology behind the refluxing vein, and it's much more in-depth than a typical ultrasound that you would get in the emergency room or in a diagnostic radiology department. Radiofrequency ablation is where we insert a catheter inside of the wall of the vein. That catheter will heat up the wall of the vein, creating a clot, which eventually will dissolve inside of the body. Laser ablation is another thermal technique where we insert a laser fiber inside of the vein. The heat damage causes a clot inside of the vein, which eventually also dissolves inside of your body as well. CVR is one of the few practices that offers the entire spectrum of venous insufficiency treatment, which includes the non-thermal, non-tumescent techniques, including VenaSeal, Varithena, and Clarivein. These are the newest techniques available, which are typically done with only one pinch instead of multiple anesthetic shots. Fortunately, 99% of all insurance companies cover venous insufficiency treatment. At CVR, we have a 95% closure rate and we have a 97% patient satisfaction rate.
I had a small opening on my left ankle and it didn't heal, and saw a dermatologist, and then he referred me to the Center for Vein Restoration. Learned that it was a venous ulcer, and within a week and a half of getting the treatment, I was running again. I was really kind of amazed at how fast treatment helped to improve the situation really dramatically. And now just 1 month after all the procedures, I just got back from hiking in West Virginia and I feel great.
I am able to be on my feet for longer periods of time without the swelling and the discomfort. It's much easier for me. I feel like I have more control of my feet and legs. I really didn't realize how bad it was until I started feeling better.
Our patients are able to walk in, get the procedures, and be able to return to their daily activities immediately. They're able to live normal, happy lives because of our procedures.
Center for Vein Restoration is always looking for committed, dedicated physicians to be a part of our team. If you want to focus your attention purely on making your patients better and leave all the extra work as scheduling, making sure patients show up on time, and all those things to a very experienced team of professionals, you are really the right physician for us. For me, success will be defined as a stage where anybody suffering from venous insufficiency anywhere in the United States trusts Center for Vein Restoration enough that they can go to the local Center for Vein Restoration and know that they will get state-of-the-art vascular care in a very compassionate and cost-efficient manner.
If you're tired of living with achy, unsightly legs, learn more about the breakthrough technology offered at the Center for Vein Restoration, the leader in the treatment of varicose and spider veins. To schedule an appointment, call 800-FIX-LEGS or visit centerforvein.com.